If you've been diagnosed with fatty liver disease, it would come as good news to know that it is 100% reversible through your diet. Fatty liver is an accumulation of fat deposits in the liver. It's a condition that may not have any outward symptoms, but there are certain risk factors that make you more prone to the condition. The severity of fatty liver can depend on the duration and extent of exposure to unhealthy foods, alcohol, diabetes, and obesity, among other factors. Non-alcoholic fatty liver disease is the most prevalent liver condition in the US, with about 30% of all adults being diagnosed with it. That's 3 out of 10 adults. Most people with the disease have simple fat accumulation in their liver. Fatty liver is dangerous as it's a huge risk factor for liver failure and heart disease. Let's look at some of the risk factors in depth. Obesity. Fatty liver is often linked to obesity because it can cause weight gain, which results in excess fat. This excess fat accumulates in the liver and eventually leads to fatty liver disease. Alcohol consumption. Alcohol is a significant risk factor for fatty liver disease, causing elevated triglycerides, fat in the blood, and cholesterol levels, which contribute to hepatic lipidosis, fatty buildup in the liver. Note, this is for the alcoholic version of fatty liver, not the non-alcoholic one, but deserves a mention here. Diabetes. Type 2 diabetes raises the risk of developing fatty liver because glucose binds with fats and proteins, leading to impaired clearance of these substances from the bloodstream. They then accumulate in tissues such as the pancreas and muscles and the liver. In fact, if you have type 2 diabetes, you're almost guaranteed to have a fatty liver. So, how do we reverse the condition? But before we go on, do consider subscribing to us, as every video you watch will equip you with the knowledge to reverse type 2 diabetes. Number 1, eliminate sugar from your diet. Sugar in the form of fructose is one of the main causes of fatty liver. Sugary foods are high in fructose that can lead to fatty liver disease. Fructose is a type of sugar that is found in fruits, vegetables, and honey. It also comes in 2 forms, high fructose corn syrup and table sugar. Fructose consumption has been linked to many health consequences, including fatty liver. The liver converts the fructose into fat, which can lead to fatty liver disease. Fructose is converted into liver fat through a process called de novo lipogenesis. This is a metabolic pathway that occurs when cells convert sugar, such as glucose or fructose, into fatty acids. The main function of the liver is to metabolize fat, protein, and carbohydrates. Therefore, it has the ability to convert excess sugars into fat stores. When fructose molecules are processed by the liver, they are converted into free fatty acids that are then stored in our body as fat. As a result of this conversion process, high levels of fructose consumption can lead to increased levels of fatty acid production in the liver, which can lead to non-alcoholic fatty liver disease. The only way to avoid sugar is to not eat any processed foods and limit your intake of grains. Grains are rich in carbohydrates, which are eventually broken down into sugar, which is not ideal if you have fatty liver disease. If you're really looking for a healthy diet, try cutting out sugars and also limit grains from your diet, and you will most likely see an improvement in your liver condition. Number 2, avoid using vegetable oils. The main reason why vegetable oils are unhealthy for people is that they have a high concentration of polyunsaturated fats. These fats are known to cause oxidative stress in the body, which is especially bad in fatty liver disease. Vegetable oils, like soybean oil, are widely used in the food industry because it has a wide range of traits that make them excellent fat for cooking. Despite its popularity, soybean oil is bad for people with fatty liver disease. The total cholesterol in soybean oil is much higher than in other oils, such as olive oil, due to its high saturated fat content. It contains high levels of omega-6 fatty acids, which are pro-inflammatory and contribute to inflammation in the liver. Soybeans also contain a lot of phytic acids that block the absorption of essential minerals, such as calcium, magnesium, iron, and zinc from food sources, which can lead to deficiencies if not counterbalanced with complementary nutrients from other foods. Another popular vegetable oil includes canola oil, which is also bad for fatty liver disease because it contains a lot of omega-6 fatty acids, which leads to inflammation in the liver. When we consume food high in omega-6, our body needs to convert these polyunsaturated fats into pro-inflammatory molecules. This leads to an increase in inflammation and can cause excessive fat accumulation in the liver. The consumption of omega-3s, on the other hand, prevents this conversion and thus reduces inflammation and fat accumulation in the liver. Instead, prefer healthy fats such as olive oil, avocado oil, bacon grease, lard, and butter. Before we head to step 3, it's important to note that these two first steps, eliminating sugar and grains in vegetable oils, are the most important and will have the biggest impact in curing your fatty liver. Number 3, make sure you get enough vitamin D. Vitamin D is a fat-soluble vitamin that plays an essential role in maintaining your bone health. It also helps to reduce the risk of diabetes, cancer, cardiovascular diseases, and autoimmune diseases. A team of researchers decided to look into the role of vitamin D in liver disease. They studied various male adults with fatty liver disease and found that vitamin D deficiency is associated with greater severity of the liver disease. The study concluded that vitamin D deficiency is an important risk factor for more severe fatty liver disease, so vitamin D supplementation could potentially be beneficial to prevent or reduce the severity of fatty liver disease. The recommended daily amount of vitamin D is 600 IU for adults. Number 4, speak with your doctor about glucophage. Glucophage is a drug that is used to reduce blood sugar levels. It has been shown to have a therapeutic effect on fatty liver disease in diabetic patients. Glucophage reduces the liver's sensitivity to insulin, and this can lead to reduced rates of gluconeogenesis and increased rates of glycogen synthesis. In the liver, glucophage does not affect fat metabolism directly, but there is some evidence that it decreases inflammation. Glucophage also improves insulin sensitivity, which can prevent glucose from being stored as fat in the body. In summary, glucophage can have a therapeutic effect on fatty liver disease by reducing the inflammatory response and promoting glycogen synthesis and insulin sensitivity. Number 5, increase your omega-3 intake. Omega-3 fatty acids are polyunsaturated fats that are essential for human health. They play a major role in heart, brain, and eye development. It has been found that fish oils, which contain omega-3 fatty acids, help in the treatment of fatty liver disease. A study in the American Journal of Gastroenterology found that people with the disease who took supplements had lower levels of liver fat and cholesterol in comparison to those who didn't take them. There are many sources of omega-3. They include seafood, fish oil supplements, flax seeds, chia seeds, and walnuts. Omega-3 can't be synthesized by the human body and needs to be obtained from dietary sources like the ones listed above. With that said, now let's take a look at 3 ways not to fix fatty liver. Number 1, do not buy any pills, powders, or supplements. When you have fatty liver disease, adding powders or pills won't fix the problem. 80% of the solution lies in eliminating foods such as sugar and vegetable oils that are harming your liver furthermore. If a doctor is recommending you to take a drug called statin for your fatty liver, then it would be a false promise because research does not support any benefit from taking statins in fatty liver disease. Your doctor may also recommend taking Avandia or Actos because there is research that indicates it is helpful in fatty liver. Again, this would be false. The research is inconclusive and it does not benefit people with fatty liver disease. Glucophage has a false reputation of being hard on the kidneys, which is not true. One of the biggest risk factors for kidney disease is high blood sugar levels, which is the result of type 2 diabetes. Number 2, bariatric surgery. Bariatric surgery is a type of weight loss surgery. It is a treatment for extreme obesity. It reduces the weight of the patient by restricting the amount of food they can eat and by changing their digestive system. The 2 most common surgeries are gastric bypass and gastric banding. Gastric bypass involves rearranging the digestive tract so that food bypasses much of the stomach and small intestines. Gastric banding restricts how much food can be consumed at one time by placing an adjustable ring around the upper part of the stomach. Bariatric surgery can help in fatty liver disease, however, it is not recommended since in fatty liver, you can heal your liver by fixing your diet. Furthermore, when bariatric surgery is performed, the changes are permanent and cannot be reversed. Therefore, it would be a big sacrifice. Number 3, liver transplant. A liver transplant is a surgical operation in which a healthy liver from a donor is transplanted to replace the diseased or damaged liver of the recipient. The diseased or damaged liver may be removed surgically, or it may die due to cirrhosis, hepatitis, cancer, and other diseases. The donor and the recipient need to be matched in order for this operation to take place. This would be the last option for people with fatty liver when there is no other way to heal their liver. However, the majority of people don't need to do this, and you can cure your condition by making simple modifications in their diet. In conclusion, if you are diagnosed with fatty liver disease, know that it's reversible and that your diet is the key. It's not so much about what you put in terms of pills and medicines, but what you take out, the sugars, starches, and vegetable oils. As for what to eat instead, check out some of our videos on the keto or carnivore diet. Thanks for watching. Subscribe to see more videos like this, and we'll see you next time.